All right, we're going to give you a technique to do at home. That's the homework that we give everybody with sciatica. And sciatica will include plantar fasciitis because the sciatic nerve will affect the heel, and you'll have heel pain. And I'll explain that as we go. And so we've got the sciatic nerve comes out of the lumbar spine here. It penetrates the glute here, and on about 14% of the population, mostly Asians, it pierces the piriformis, where it literally goes through the piriformis. And the piriformis is a muscle that does external rotation. It turns this bone like that, right? And so it can pinch the piriformis if it's even close to it. So it comes down to here and it splits right through the center of the hamstrings between the muscles, and in this fascial compartment, it slides through there. It goes through the back of the knee, right through the calf muscles, the deeper one, the soleus, which was underneath. It pierces through that, and then it goes to the bottom of the foot, and if it's S1, it'll hit you in the little toe. And so if you've got sciatica, it's down the back. If it's L5, which is a higher spinal level, you'll get pain, numbness in your glute and just the outside of the calf and then into the foot. Now here's like a clinical rule of thumb, not law. If the sensation is going down, it doesn't go past the knee, it could be just stuck in the glute. If it goes all the way down to the foot, the entire leg, it's probably your back. And if it's in your back, you probably need to go to the doctor for this. Now, but if it's all the way down the back, that's sciatica. If it's going in the front and you're getting some up in the front of your leg and this thigh, then that's the femoral nerve. That's a different nerve. And so this sequence isn't going to work for that. That's not sciatica. Okay, that's a different nerve. So we're going to release this from the bottom up. We're going to do the calves to release it, to free it up there. We're going to free it up in the hamstring. We're going to free it up in the glutes. And then we're going to glide the whole thing out. Right? And if it's all the way down to your little toe, all the way from the top, you know, could be herniated disc or something like that. You don't know unless you go to the doctor to find out. You don't know what's actually going on in there. You need to find out. But what we would do in clinic, if it's herniation, say you have an MRI, we know that, we would lift this up, we would clear this out, and we would give them literally this same homework, right? It's a very good sequence. If you're in a place where you can't go to the doctor, give it a shot. Try this and see if it works for you. If you get worse after doing this, this is not for you. It's not going to just get better one day. You got to quit doing it, right? If you get worse after the first go, you got to stop. Okay, it should feel good. Okay, so first we're going to release the calf. And so you could have plantar fasciitis just from a tight calf because the fascia that goes to the heel is connected to the calf. And so if the sciatic nerve is irritated, the calf will tighten, it'll lift this up, and it'll literally just pull on this all day, right? And so that would be a plantar fasciitis situation created by the sciatic nerve. And the sciatic nerve is pretty much always involved with plantar fasciitis. And so we're gonna stretch the calf. So he's gonna get on the wall. This is easier with a shoe on. And he's gonna put his toes on the wall like the ball of his foot, and he's gonna upright his body, lengthen his body, and bring that hip towards the wall. And this one is a much more effective stretch than the one we all did in middle school where you're just doing this, right? This is much more effective, much more direct. A shoe is better, okay? And he's gonna upright, and he's gonna stretch that. And it's just hold it for 10 seconds or 15 seconds, and then get out, do that 3 times. All right, we're gonna release the hamstring because the sciatic nerve goes right between those 2 muscles. All right, so I'm gonna take the ball. I'm gonna use, this is a lacrosse ball, but you could use really anything that's firm to stick under here. And so we're gonna lift this up, and I'll put that right kind of in the belly of the hamstring. Find your spot, you'll find it. And then he's going to lift his toes, which is gonna pull on that calf, and then straighten the leg. You gotta push this down and really pin that ball. And so what we're doing is we're stretching the front part of the hamstring. The ball is not allowing for the back half to stretch, and it's not pulling on the low back. If you pull on the low back with the sciatica, you can make things a lot worse because you're gonna create a guarding of the whole sciatic nerve system because it feels like your spine is being pulled out. So this is a secret way of stretching this without the back knowing. Okay, he's going to do that about 10 times, and then we're going to move it back here. And anytime you have low back pain, and I just rolled it back near the sits bones, and he's going to do it again. One of these you'll feel more than the other. If you don't know why you're doing this or have any feeling whatsoever there, probably don't need this. Anytime you have lumbar pain across your back, try this right here. Try this exercise. Now, this isn't going to fix the sciatica, but it sure is going to make it feel better, right? It's probably a stability problem, and probably an intrinsic core stability problem, actually. And so that is treating the hamstring portion. So now we're going to release the sciatic nerve in the glute. Okay, so he's going to go into a figure 4. Now, if you have sciatica, you're probably going to have trouble getting here. It may be like this, right? This thing may be up in your nose. It's okay. Do the best you can, because that's why we're doing this, right? And so don't get crazy about keeping this knee straight. The straighter this knee is across, like horizontally to the floor, the more the piriformis is involved in the stretch. Don't worry about it if you can't get there. It's okay. Then we're going to do a technique called kiss the foot. He's going to upright and he's going to hip hinge. He's going to hinge at the hip, not roll his back, because we want the stretch at the hip. And so it's going to come forward, and then he's going to go towards the foot. And it's called kiss the foot because some people can get that far. If you're doing this with sciatica, you ain't kissing the foot. It's okay. Okay, then we're going to add a muscle activation and release called muscle energy technique. So he's going to grab his knee. He's going to lift his knee towards his nose and push his knee back into it, which activates the glute muscle. He's going to do that for 5 to 7 seconds. Inhale, relax it, and then go back into your stretch. See, he's going to go farther. And he's going to find an angle that he really wants to get. So maybe I want that angle. So come out just a little bit. Pull it from here. There. And then activate it. So 5, 4, 3, inhale, 2, 1, exhale. So the exhalation phase is the relaxation phase for your muscles. It actually works to do that inhale, exhale. And so that is the kiss the foot to release the sciatic nerve in the glute. Okay, so now we're going to do the entire sciatic line, right? So he's going to have his hands on the wall. He's going to bend his knees. You got to bend your knees because look, if his knees are straight, that's just going to hurt. We're not trying to do that. So come back up, bend the knees, hip hinge to the wall. See this angle? So he's putting tension on the sciatic nerve there. Then he's going to straighten the legs. He's going to turn it on and off, on and off. So he's creating tension on the sciatic nerve, on and off, on and off. Now, if this is too painful, you can do the unaffected side. Say that his right side is the one that hurts, he's going to do the left side. That's going to actually start releasing the nerve within the spine. Right? Do that a few times, and then keep that one bent. Now try to do the affected side. And just don't torture yourself, but you got to get it, okay? And so then eventually you do both. And he's keeping this hip hinge. If you have sciatica, true sciatica, especially a disc herniation, you're going to be up here. You're going to be up here doing that at this angle. That's totally okay. That's normal. Now, in the clinic, what we do is I'm watching for the L spine and to move. And so as he comes up, does the L spine make a jump? And if it does, you stabilize that still. You put a little traction towards the nose up here, superior traction, open the facets, and then let him sciatic nerve glide this. So he's creating the motion and I'm creating space. That's how we do it in the clinic. It's a very good technique. This is a very good technique. It's a very good sequence. We have a lot of luck with this. Now, if you actually have sciatica or you have a herniation here, you have lost your stability system because the final piece broke. So your intrinsic core is down. And so you really want to look at diaphragmatic breathing and stability of the global core system to actually fix this. But if you don't have access to that, you could pick the one of these 4 exercises that work for you and just do that, just to maintain. I did it for like 3 years. I just did the lacrosse ball under the hamstring for my back pain for 3 years before I finally got stable. And I haven't done it since. So that's sciatica.